Hello, everybody. Welcome to Pain Geeks. My name is Laura Rathbone. I'm the co-founder of Pain Geeks alongside my friend and business partner, Christine Pedridis. And we are an international reading group. We promote critical thinking and academic skills for clinicians who are interested in pain. And today, I'm really, really happy to be joined by a good friend, an awesome researcher, Professor Tasha Stanton. Hello. So, Tasha
Hello.
is yeah, we've spoken a few times actually, and on Pain Geeks, there's already a lovely interview with you from I think 2020, where we were really talking about your work. So anybody watching now who hasn't seen that, or after this, you can go and watch that, or you can pause this, go and watch that first, and then come back. That would also be fine. Um, but Tasha, your background is in physiotherapy, but then you went on to do more research. And right now, I have that you are the head of the persistent pain research group at the SAMRI Institute, which stands for the South Australian Health Medical Research Institute, which sounds pretty like it keeps you busy. and and you're also the co-director of the Impact Group. Um, and I love what this stands for as well. So, because it just really hits our values in Pain Geeks as well. So, like innovation, implementation, and clinical translation for pain research. And I was on the website today, and all of the directors are allied health, which is like, as a physio by background, that's just super inspiring and makes me think, okay, we do have a really important role in this research. And a really important voice. And we are the experts when it comes to integrating some of this stuff. So I'm really happy to see that. Um, and I just saw that you've received 9.3 million Australian dollars in research funding. Um,
Give you a little update there. That's a little bit higher, which is quite exciting. So we're up to 14.7. So hopefully we can do some good things.
and this is just amazing, like $14.7 million of research funding. Like, I just want, like, I don't know. I'm sure your support network and your family who love you dearly keep reminding you to just take a moment and acknowledge that and the achievement and when we think about the money, it's a lot of money, but like actually each research article is influencing, thousands of clinicians, which is then having this knock-on impact on improving pain care for thousands of people that go through clinic. Um, I don't know if yeah, how does that make you feel?
I mean, it's so exciting. And anytime that you feel like you can see any real world impact of what you're doing, I think that's a really special place to be in. And
Mm.
it's one that I think keeps you really humble. But it also, I think, really I don't know. It's that really happy feeling of feeling like, okay, yeah, I've got energy. I feel inspired to continue to do stuff because it can be hard when you're kind of going through all the rigmarole of getting this stuff up and funded. But no, I you make a really good and important point that it is really important to just sit and be like, yay, this is really happy because you speak to any researcher, I mean, any clinician that's working the front line, we work so hard to do our very best. So no, it's really exciting. Thank you.
Yeah, yeah. And I think so it says on the website for the South Australia University, the University of South Australia, sorry, that your work is focusing on sensory and cognitive contributions to pain. And like that is such a massive sentence, right? Like that shouldn't be
Wide.
radical, really, but it is radical, right? And like the work that we talked about when we first met, the illusion work and the perception work was part of this like culture shift in pain care that helped us to say, no, actually, thinking about pain as a perception is evidence based because you provided us that evidence. And that's powerful.
And I think it what I find really interesting to that is oftentimes I feel like we go down these different streams, not knowing where it's going
Mm.
to end up, but just trying, I guess, to plan the most rigorous studies that we can to ask a question and to be a bit brave and be like, oh man, this could go very wrong. But so much of that stuff, I think we have to push things because
Yeah.
pain is complex. I mean, if it wasn't and all of our treatments are working, well, perfect. We don't have to push things. But the truth of the matter is that many of the frameworks and the treatments that we do and that have been, mired in tradition, they aren't working. So I think in some ways that also gives us a bit of lateral room to be able to say, actually, no, this is worth looking into. And for me, I guess just understanding even a little bit of that complexity not only I think helps us make theories from a scientific perspective, but it also it gives us ways to explore and explain our own experiences of pain and our patients' experiences of pain. Because if that's not out there, we're never considering the myriad of factors that actually might play a really important role when they all come together and coalesce for someone's life. So no, I think it's really nice to see that trajectory because I think I've certainly found personally spanning that gap of kind of experimental studies to then flipping into a clinical translation where you're actually able to get that into the clinic itself. It's a challenging part.
Yeah. As I'm listening to you, all that I keep thinking of is that, this is really saying something about, I mean, even just our current cultural situation, this, science is inherently progressive, right? It's
Yes.
about saying, look, this is the status quo, which is the conservative position, and saying, what do we need to do next? Like how do we improve on this? How do we make this bigger? How do we make this more accurate? How do we make this more efficient, more meaningful, and asking the sort of revolutionary questions? And I think this is one of the things that maybe when you're a clinician, you're always looking back on the research. And so you don't necessarily realize how much of a part of this progressive, revolutionary system you're actually in. Um, and I mean, I'm sure when you started thinking about perception in knee pain, there were some people who were like, "Oh, what's this all about?"
I
And
think they're still there.
right, and critics, and there'll always be people who take a conservative position and who pull us back into, the model that has been the dominant model that might not have included perceptual experiences or perceptual ways of knowing when it comes to pain. Um, and then at the same time, exactly what you said, the stuff that we're like the approaches that we're using on the floor, they don't necessarily work as well as we would hope them to, or in ways that we would want to be able to predict. And so we need to keep working and finding new ways. So yeah, I
Mm.
just really appreciate that. How
Oh,
cool.
thank you.
You're a renegade. And I think one of the things that I really sort of love about you particularly, and I hope this doesn't feel too direct, but or too fangirly because I can be very enthusiastic. But as I've seen you grow over the last few years and watched you in your career, like you really seem to value research dissemination. Like you're at the meetings, you're giving the lectures, you're here on Pain Geeks now giving the talk. Like there's never been a moment where I've been like, you know, I've always known I can ask you to do something and you're so happy to share. Um, what's the hope for all of that? So just thinking generally about your work, like what's your hope for your work in terms of clinicians and patients or other researchers?
Look, I think at most, I think it's to cause someone to think and to feel curious about the way that we approach something. Because I suppose a lot of what we do, I think when we're trying to do things the best that we can, and maybe something isn't going quite as well as we might hope, it can be really, really hard actually to reflect and try to understand what we might be able to do better. And so I sort of feel like some of the work that we've done is, or tried to do, is sort of saying, actually, there's probably quite a bit more going on than we might have realized. Here's one extra thing to think about. But also, if we approach this from a place of course, we don't know everything. Why we would never be expected to do this. And it also, I think, softens our own ability to reflect ourselves. And because then we're not being defensive about what has gone wrong. We're not feeling bad. We're not feeling shame or guilt. It's all about actually, I want to foster, I suppose, this innate curiosity in what is contributing to all of the different, therapeutic alliance experiences that people are having, their actual pain experience? What are all those contributing factors, and what can I use within my skill set to do the best that I can? And I suppose dissemination has felt like a really important part of that, because I think the way that we speak about things, even if we know something on paper or we've heard something in a research study, often the way that in which we deliver it can make a huge difference, to not only the impact that it has on someone else, but also I think the accuracy with which what we're saying, because I think that's always a really challenging
Yeah.
aspect of any dissemination. But for me, I guess that's always just been a really important part, because that is what fosters conversation and what fosters curiosity, because you're sort of being presented something in a way that just says, wow, maybe we just need to think about this a little bit further. And I suppose um, where my career has kind of gone is, as I alluded to a little bit more or before, is that I've kind of moved from a lot of very experimental work to kind of shifting into how can we take some of these things and properly translate them into clinical settings so that things that we've found in these studies are actually accessible to clinicians and to patients. But also, how do we work more closely and more authentically with people who have lived experience of pain, so that instead of me taking what I think is the problem and designing the solution for them when it probably wasn't even the problem to start, maybe what I'm doing is actually working with people with lived experience from the get-go to understand the problem and then work with them together to develop that solution. And I think for me, that it's not that I before never really wanted to do that, but I didn't have the tools or the knowledge of how to do that. And so we've made really purposeful partnerships with people who are excellent in this field to help us understand how to undertake co-design properly, where it's authentic, it's collaborative. Our people with lived experience are our co-researchers. Um, and that for me has really been a transformative part of my career, because it's really directed largely where our research is going, is I'm not deciding. So it's actually an enormous relief.
Yeah, because that's it. So actually, co-collaboration in its most. Oh, you can hear Bobby squeaking a toy in the background. She agrees. But like co-collaboration needs to be equitous, right? And what's super interesting in that is we're seeing social justice reform in how we do research about pain, and that is then promoting social justice reform in how we do care for chronic pain, but also how we structure societies, and
Mm,
how we start breaking down systems of oppressive power and start building up
mm,
systems of collaborative sort of shared
mm,
power. And I think all of this is such a beautiful mirror.
mm.
Yeah.
And I think there's such important conversations to have, because even I think showing the value on one scale, which is maybe pain management or something within our direct field, I think when you see the benefit that occurs from it, first of all, I think it's a very powerful message towards the value and the need for diversity in voice. And that extends beyond just the fact that we're thinking researcher patient, we're thinking, diversity on a wide scale. Um, but it also, I think, really, really puts home how many things, when we really think about it deeply, they've never been created that way. And so should we be very surprised that they're not working well when what we have is an incredibly diverse society? So yeah, it's been a really lovely journey, I think, of exploration that has also just made, I suppose, me feel quite solid that the questions that I'm asking are important. And that is feels big.
Yes. And I think there's something there also interesting around, something feeling solid and sure in with a topic that requires us to feel comfortable with uncertainty.
Mm.
that is quite, I think, for me anyway, as a clinician, as a non-researcher, just somebody that's in, using research to continuously improve my practice, to hear a researcher say, I feel really comfortable with the questions I'm asking. I feel really like sort of sure about the direction I'm going in. That gives me a sense of, oh, okay. Like we're not just
There's a plan.
there's a plan, which is a relief. I mean, I know you've got a plan, but like on my side, when I'm in the clinic and I'm like, I don't know what we're doing, it does feel very like. I think what I want us to feel as clinicians, especially now in this sort of like anti-science culture that seems to be growing, and I want to talk about that a little bit as well. I want us to really consider just how much we can trust our researchers and be able to repair that faith, not faith, but not faith as in religious, but faith as in
Yeah.
good faith relationship um, between us. And I think that's a big part of what we're trying to do in Pain Geeks, as well as our colleagues in other groups as well. Yeah.
Yeah, absolutely. And I think it's also, it feels like from a clinical front, is also feeling very certain that your voice is so important. Like, I'm not regularly getting to see patients. Our clinician partners, like in addition to lived experience of pain partners, are amazing. And they're the ones that are like, I don't know, have you thought about this? Oh, I don't know. Like, I see this sometimes. And you just get, I think that is so important. And it's important when we know when our things that we might have tested in a clinical trial that showed evidence of benefit, if they don't help or if they're not working when it's in a certain clinical environment, that is such important information to know. And that's not a, I mean, I would never take that badly. That's something like, oh, that is really important. We need to understand that. Or maybe what structures, what resources need to be put into place to facilitate this use because the one model we've just tested doesn't work. And so I think that, yeah, there's a lot of, I feel like, opportunity for many of those things to be adapted and changed for the better as well.
Yeah, absolutely. Okay, I'm going to bring you to your Instagram post because I was so happy when you posted this. And I'm looking at it now and like, I can't believe that it was actually the 28th of March. That's just 2 months ago, right? But it feels like yesterday, but it's gone so
Crazy.
quickly. Um, and your post is like just full of joy, which I think is wonderful. And one of the things I love is that you celebrate your work. And that's not a small thing, right? To celebrate your own work, especially I think, and I don't want to pull this into sort of conversations around gender, but I think especially as a woman in what has typically been a male dominated, a man dominated space, Bobby, calm down. I think it's wonderful to see women really say, look, I'm doing really well here, and I want to celebrate that with you. And it says in your post that you've just successfully received the grant, or it's just been approved for 2 million Australian dollars. So there's that upping of the of the amount of research money. Um, I don't know if you're allowed to tell us very much about your research plan here, but would you feel comfortable just telling us, what this is about and what this is for and how this has come about?
Yeah, of course. I might just add on quick to this I like celebrating sort of wins. I think also what's quite nice is because these ventures are such a team effort that it also like I know that feeling of like, oh, don't toot your own horn. It feels awkward. It feels whatever. But this is so much work that goes into this. This is celebrating our people of lived experience that contributed and said, I think this is a good idea, but maybe test it like this. It's like all the clinicians that have been involved and told us. It's all the other researchers that have put in so much time and effort, admin staff at the university that check it over a million times. Like it's such a team. So I think that in and of itself also probably from a personal perspective makes it easier to do that and you don't feel like you're being a tool. But also because it is, I feel like a win, right? For like I want to celebrate everybody's things. Like research is hard. It can be tiring. Like this, it's so important that we do that. So like I never feel bad. I mean, I guess if I had a bad day, I'm like, oh rats, I wish I would have won that. But I can honestly say I'm only happy whenever I see anyone else get that stuff. So please, if you've done well, write it because I want to like it and be like, woo, good job. But moving on, back to your original question before I derailed us.
And
Um,
especially in pain, right? Because it's one of the more
yeah.
underfunded areas. And, this is important, the months that it takes to write these grant proposals and to prepare for them. That's what you're celebrating.
Yeah, exactly right. So true. But so this one that you were referring to, this grant, it was it's a big clinical trial that we're aiming to run that's going to last about 5 years and probably recruit about 400 people. And it's looking at people who are undergoing total knee replacement surgery. For osteoarthritis. And what we're trying to do is basically prevent development of persistent post-surgical pain. So it's going to be a very challenging study to do. But some of our work I guess really set us up that this was the right question to ask now. So some of the work that my master's student Carrie Taylor did, she's now started her PhD, but it basically looked at people who had undergone total knee replacement surgery and it just followed them over time and over about a year. And what we found is that there was nothing at baseline that predicted whether people would develop persistent post-surgical pain. And that comes out a fair bit, or the studies don't match up. One study says this, another study says that. It's really, really hard to predict. But then what we saw is that at about 1 month post surgery, which was our first time we measured them, there was a clear difference in clinical trajectory in terms of the people that developed persistent post surgical pain kind of immediately didn't do as well right after surgery. But one of the things that really differentiated those groups that the group that got persistent post-surgical pain and the one that didn't was people that had altered perception of their knee. So it didn't feel right to them. And so basically what this trial is testing is our hypothesis is that people who still have this feeling that their knee feels wrong, it's almost as though they're not taking on the new joint replacement as their own knee. And our other work shows that when you have high levels of perceptual dysfunction, you don't respond to exercise therapy. So you might be not taking on your own knee, but then you also might be the ones not responding to post-surgical rehabilitation. So some beautiful work that was done by Dr. Tomohiko Nishigami and Dr. So Tanaka, who are collaborators of ours from Japan. They did a kind of a pilot trial where they took people who had early after surgery, post-surgical pain, or had higher levels of pain and higher levels of perceptual dysfunction. And then they gave them kind of a sensory motor training program and then exercise. And they had really nice preliminary results showing that it was helpful for pain function and improved body perception. So that was like our base. So that's really what we, through that collaboration, through the pilot work, but this is over 10 years that we've done all this different stuff. And it kind of all came together at the right time. So yeah, so we're
Oh,
testing whether
sorry, I got a
this
bit excited.
sensory motor training paired with rehabilitation is better than standard care.
This is like, just on a personal level, I have to say that I'm really, really excited about this because I've been having this conversation with clinicians about this idea of people who have joint replacement surgery going on to have a kind of phantom type pain that is
Yes.
beyond, because ultimately they've had an amputation of a part of their body, right? And for some people, they're able to make sense of that amputation really well. They might go on to
Yeah.
have some sensory dysfunction or some pain, but they sort of seem to get through that really well. It becomes part of them quite quickly. This idea of re-embodying, which really
Yeah.
also builds on the early work of Lorimer and, from way back, thinking about
Yeah.
body perception and body image.
Yeah.
And then even more so on your work with the illusionary work with the joint as well, because it's
Mm.
something about how we perceive our body after
Mhm.
injury or after there's been a change that seems to be key in yeah, I guess how robust we are as organisms in terms of our perception and ability to move forwards. That's really exciting.
Mhm. Yeah, we are really excited to do it because I think it it's one of those ones that it's going to be really hard, but you'll have an answer. Like
Yeah.
you're able to ask for enough money to test it well and test it right. And so, no, we're really excited.
And then there's always the problem, and so we will have the data, but then how we interpret the data, through which theory of perception, through which theory of consciousness, through which how are we going to do that? Because there's always, and I think this is one of the things that we're sort of coming to terms with as a community in Pain Geeks as well, is like these theories of perception, they're exactly that. It's a theory.
Hmm.
There's, we can use one theory and understand some data in some way, and then you might rethink that data and use a different theory, and it might give you different answers. And so that's also a question. Have you, yeah, what sort of theory of perception and consciousness are you going to be using?
Yeah, it's a really good question. I think probably this has been most underpinned by more traditional predictive processing.
Mm,
So when something, when you have this impaired perception of something, there's changes in the way you're able to update internal models using internal sensory information coming in, all of these different things that have experimentally, I think, been shown quite nicely, but also we're starting to see, I guess, sometimes those links to clinical conditions in different studies. But I think you're exactly right that there's quite a few different ways that we could look at it. Probably what will be most important is when we think about some of the mechanism testing within the trial, and doing so in a way that we can actually measure that on a very large group of people. I think that's probably one of the most challenging things, is that some of the ways that we would love to look at a really in-depth, nuanced look at mechanisms, you actually almost need to have a whole nother grant to
mm,
then pay for that bit. So I mean, that's something we could look into doing. At the moment, we're a little bit limited in that we probably have to use more things like perceptual questionnaires.
mhm.
Possibly you might be able to squeeze in tactile acuity, but when different people are doing it and testing it at various hospital sites, I would not find that reliability super promising. So, yeah, but I
That's the
think you're
polite way of
really
saying it.
It's amazing. We've been like, using that in other studies, and the amount of training that it does take to ensure that people are doing it quite consistency is not small. So
No, and even then, there's still inter-rater reliability issues,
yeah,
and
absolutely.
because we're just different, if you're in a different cultural region, you're going to do things culturally different, and those are things that
Yeah,
you can't control for, as well.
yeah,
Yeah.
100%.
Yeah. Ah, wow, that's really exciting. So how long is the project going to take, do you think, in total?
So it will be for sure 5 years. We've had to delay the start of it a little bit because there's lots of hospitals involved, so you have to get a lot of collaborative agreements in place.
Yeah.
And that takes a lot of time. So that goes to lawyers, that goes to different people. So that's usually about 6 to 8 months. So
Yeah.
we've just given ourselves time to set it up and then get lots of things in place and hit the ground running next year.
Yeah, lovely. Oh my gosh. So, I mean, just even hearing that 5 years is like,
I know it feels so long, doesn't it? Like when you start to do any of these studies and you're like, oh my gosh, no, you absolutely need that much time. Oh my gosh.
yeah, no, I believe you. I believe you. Okay, so just before we go, oh, Bobby, you're okay. Don't worry. Just before we go, I want to ask you a bit more of a political question, I think. So, one of the reasons why it's important to celebrate. I don't know if she's going to let me
Bobby's
carry
getting
on.
political. I love it.
I know. I might just quickly go and let her out. I'm just going to
Yeah, of
quickly press
course.
pause. So we're back, and now I've got Bobby chewing on my finger, which will hopefully help keep her quiet for a bit. But yeah, one of the reasons why I it's really important that we celebrate the research wins in pain is in light of the what's happening at the USA's policies on how it's not sure what's happening.
Yeah, it's like a couple, like clicking or something.
Okay, sorry for that. We just had a technical difficulty, but it's all back now. It was probably Bobby's fault. But yeah, it's because of, what's happening with in terms of the Trump administration and their sort of current commitment to reducing the funding of the NIH research institution, the National Institutes of Health. And I think sitting in Europe and sitting in Amsterdam, we might think that's got nothing to do with us. It's in the USA. What does that mean to me on the shop floor as a clinician working in, by Oster Park in Amsterdam? Like, but the reality is that the evidence that we base our practice on, because we are contracted to being evidence-based clinicians, which means we are responsible to update our practice as the evidence changes. And what I see is that if there's a significant reduction in funding for, say, for example, NIH, which funds a significant amount of research, not just US research, I don't think, or there's like research collaborations internationally, right? Um, and if the new proposed plan is to strip it of like almost 50% of its funding, annual funding, and to start pulling groups together and to restrict research that might be looking at, for example, women's health or gender or racism or social constructs and social power and how that influences people. And as somebody that works with chronic pain, the majority of my patients are, low income. I see lots of people who are immigrants, people who are experiencing racism on a daily basis, who experience not only that, but just ableism, like the discriminatory power of ableism is huge in our population. Um, what's your sort of like, so when we do get a big piece of funding through for a pain research, I think right now I'm really relieved to see that it's still happening more than anything. Um, but like, what's your sort of perspective on how much influence do you think this could have on just international pain approaches and science?
Yeah, look, I think it will have a big influence. Like I think in many ways, we're watching the fall of the US in terms of being a world leader on many fronts. Um, and I really, honestly, my heart goes out to research colleagues that are in the US. We all know how bad it is. It's so awful. And like we are hurting with you and for you. I think with that, and sorry, and you are right that actually NIH funding, lots of people from international sites can get it. So the US asked different universities in Australia that had NIH funding to basically explain why do you have it? Like, why do you need it? This is for US citizens. So it's gone from an international global focus to a nationalistic, in not a good way, focus. I do think that there is there will be impacts because I mean, it is one of the biggest places for research in terms of funding. I'm quite sure they lead it in the world. Um, some of the things that I have seen that have been really nice have been, Pain Journal. So the editor Karen Davis speaking out and saying we will continue to, promote research and publish research that is in the area of diversity. And I think we see the similar thing with Tanya Palermo with Journal of Pain. But actually, what I see with this is there is such an opportunity for other countries to become a world leader in research. So you have so many people, scientists that are in America that either can't work there anymore because of their visas, they're being revoked, or they can't leave to go home to visit family because they're not sure if they're going to be able to get back, or they might be arrested. And that is a true reality. And I think that gives an opportunity. There are going to be flocks of scientists and researchers leaving the US for other places. And so honestly, a smart policy of Australia, of Canada, of the Netherlands, of, the UK, increase your research budget, recruit. These are excellent scientists that are doing groundbreaking things. And then you just build capacity elsewhere. Like the whole thing of research is we are constantly adapting, like clinicians, like any system, to all of these different changes that we often have very little control over. But the thing is, we're resilient. Like we get rejected all the time. Like, so I think as a field, like I think what we can do personally is also reach out and ensure that we're collaborating. And if there are there are streams that can be done elsewhere and really good work with the researchers to get that work done. If we can integrate, for example, something into a clinical trial, like the one that we'll plan, it can be, purposefully being there, walking, going to protests. Like, I just think it feels like it's so big and overwhelming, I think, because all of the different changes are happening all at once, and all you see is just things getting gutted. But like it's some of the this sounds very, very not humble, but you're looking at really smart people. Like this will happen. This research will continue. It just not might not be in the US.
I think that's a really lovely point to make, Tasha, and I'm really grateful that you said that because it can feel really scary when you look at it and you think, what's the future going to be for us? And on the clinical ground, we're seeing a lack of funding for pain treatments because we don't have the evidence to support that people get better, which means they have less pain. And of course, that's the wrong metric very often with a chronic long-term condition. Um, but it makes it very hard. And I think for many, many years, what I've seen consistently is the researchers have the clinicians' backs and saying, you guys are doing really, you're doing the work. How can we support what you're doing? How can we help you find the evidence of what you're doing? Um, how can we keep supporting you to improve? And in a way, there's a moment now where maybe we have to return the book a little bit and just say, hey, look, we're so grateful for the research that you've done. And we're so grateful that you did all of that hard work, all of those months of, I'm sure were quite extended hours and, stressful moments to keep providing us with a wide and rich evidence base so we can continue to do our work that is enormously difficult
Mm.
with the person in front of us. And so
Mm.
what like also what a moment for us to sort of turn towards each other and realize that we need a good relationship, and that's why things like co-collaboration and working on
Mm.
it is so important. um
And I think
yeah.
it also, for me, really highlights the key nature of a clinical researcher role. So people that have, done a master's, done a PhD, and then they still have a major part of their career is clinical practice. And it's either like for some people that we work with, it can be facilitating research. So being like, no, this is a research clinic. Anything that you want to run out of here, we're really happy to facilitate. These are the costs that we'll need from an administrative point of view to be able to run this. We put that into grants. So all of those things, I think the relationships are incredibly important, but also I think there really actually is a gap and an opportunity for people who are interested in understanding research, but maybe don't want to do the whole rigmarole of having to apply for all stupid grants and it's all hard and too much. And that's a very valid life choice to make. I will not disparage that. But then it also means that if you have some of that expertise about how to do research, how to set up a study, those are key things that we can work together, and then actually it's getting the best of both worlds, I think.
Yeah, I love that. So, okay, let's bring this to an end. I just love catching up. I could talk to you for hours and hours, but I really appreciate your time this evening as well, because I know it's sort of getting late over there now. So, thanks for giving us your evening time. Is there anything that you want to sort of share before we go? Any last statements that you want to make? And I know that's put you on the spot, so I'll give you a few more seconds whilst I ramble to think.
No, no worries. No, I just think that I'm really excited and I feel empowered by the new group of researchers that are coming through. They're so like that are just coming out of PhDs, they're early postdocs. They are so switched on, so capable. Many of them have been really embedded within co-design already. Like we are in good hands. So I think as a message from what's going forward, I think we're only going to see work that is more impactful because honestly, the people that are coming through are just legends. I can speak personally for the students that I have coming through, but also through my colleagues that are working in the area. And I think it also has been a generation or maybe two of having researchers really lift up their students. And I certainly was a large benefit. I received a large benefit of that. But I think that that really is becoming the norm, certainly within the group of people that I very much value and choose to collaborate with and work with, is that it's it's about creating the environment for someone to succeed, not waiting around for the people around you to fail. And that to me is just such an important shift, because I would, at the end of the day, I would so much rather be around creative, curious people who are kind than the smartest person on paper. But they're not they don't hold those values that really resonate true with you. So I don't know. I think we're in good hands.
Oh, lovely. Let's leave it there. Thank you so much, Tasha, and good luck with everything. And I'm sure we'll be catching up soon to find out more of the research. The dog is just annihilating my my house. Okay, so
Thanks
we'll
for
say,
having me.
yeah, I know you're welcome. We'll say goodbye. Thank you. Bye.
Bye.